Chris Bryant to move the motion.
Eagle, it is an enormous delight to sit under your chairmanship, as I've never done so before that I can remember anyway. Some have greatness thrust upon them, and I've always waited for this moment. I beg to move that this House has considered the matter of neurorehabilitation and COVID. As members will know, this is an issue that has been close to my heart for some considerable time. The issue of how brain injury is treated and dealt with in society. Myself and my honourable friend have been running an all-party group on acquired brain injury for the last few years, and it's been a frustration to us that we've not been able to hold so many meetings this year as we would like to. But I'm determined that we are going to move forward on this. Any honourable member, most honourable members, will have had moments when they have visited either a headway group or the local hospital, the local trauma centre, or perhaps one of the daycare centres run by their local authority, where they will have met individuals who've had traumatic brain injuries, perhaps people who've suffered from carbon monoxide poisoning, people who have had a stroke, any one of the many different ways in which the brain can be injured. And they'll know the great joy that there is for many families that somebody's life has been saved, and the great sadness that the quality of life is not what people would want it to be. And indeed, I praise the government for setting up the major trauma centres, because in the last few years, these have undoubtedly, despite lots of controversy locally in many parts of the country, they have undoubtedly saved many lives. Probably in the region of 800, 900 lives saved a year because of those centres. But many of those people come out with brain injuries, and the pain for the individual and for the families surrounding them can be phenomenal. I want to say up front the things that I want out of this, if I might, to the Minister, just so to be absolutely clear. I want a national neurorehabilitation strategy. There isn't one at the moment. There's lots and bits and pieces of strategies, but there isn't a national neurorehabilitation strategy. I want a national neurorehabilitation lead, a single person who is in charge of this. Now, I've heard rumours that there might be somebody who has been put in charge, but I'm not sure, so I hope that the Government Minister will be able to respond on that. I want a mandatory system, not a casually achieved system for commissioning neurorehabilitation, in particular within the community. This is far too patchy up and down the country, and I'm not even referring here to the differences between England, Wales, Scotland and Northern Ireland, but even within England it's far too patchy and insecure. I have a real fear that after COVID we won't actually reinstate all the neurorehabilitation services that we had before COVID came to these shores. I have a real fear of that, and so I want a guarantee from the government that all of those services and more are going to be reinstated, and all the posts that have been furloughed or suspended or not appointed to throughout this year will be kept and will be restored.
Will the Honourable Member give way?
Of course.
I thank the Honourable Member for giving way. And will he agree with me that our report, Time for Change, produced by the All-Party Group with the help of UKABIF, actually demonstrates the real importance of neurorehabilitation, both in acute settings and also in the community-based cases as well?
My honourable friend is absolutely right, and I pay tribute to the work that she's done on this in lots of different debates, and in particular on the relationship between neurorehabilitation and education. But she's quite right. It's about the individual in the acute setting, perhaps after a traumatic brain injury in a car crash or something like that. And then it's about that person being given enough neurorehabilitation so that they don't need an enormous care package when they go out into the community, but then also making sure that there's enough ongoing neurorehabilitation in the community to make sure that they don't fall back on to requiring even more of a care package. Not because I want to deny care packages, but because I want people to have an independence of living, a freedom that we would all want for every individual. I just have two other things that I really, really want. So I'm sounding like a popular beat combo from previous generations. My husband will be proud of me. What I really, really want is that neuro rehab, should be one of the 12 specialties that is protected during COVID. Now, I know I've made this argument about cancer as well. Cancer's had lots of coverage in the country, and quite rightly so, because, and I hope very much that we will see very soon the Cancer Recovery Plan, which we've been waiting for some time. But we also need one for rehabilitation. And I'll come on to some of the reasons for that, for why. And then the final thing I really want is a coherent, consistent, tidy arrangement of community neurorehabilitation across the whole of the country. So that whether you're in Wells or you're in Winchester or you're in the middle of Manchester, you have the same right for yourself or for your family or your loved ones in terms of ongoing community rehabilitation. Otherwise, I think it just seems terribly unfair. And one of the things that so many families have said to me time and time again is that they feel as if they're pushed from pillar to post. They hear a story of somebody getting this sorted in one part of the country, and then they find that it's simply not available in their part of the country. And that's why, again, I reiterate, I really do want a single, coherent approach towards brain injury. Not just in neurorehabilitation, though we do, as I said earlier, need a neurorehabilitation national strategy, but also we've got to bring together all the different elements, I think, and I've spoken to, I don't know what his title is, but the minister who runs, Michael Gove, anyway, him, the one who runs the Cabinet Office. I've talked to him about the need to bring together all the different departmental ministers into a single committee to look at the interaction between the work of the Department for Work and Pensions, the Department for the Ministry of Defence, which deals with many veterans who've had brain injuries in active service, education, health, the Treasury, of course, DCLG, because they look at, with housing as well, they look at the provision in local communities, and for that matter, the Department for Culture, Media and Sport, because one of the most depressing and upsetting things, I think, this year has been to see the family of Bobby Charlton having to say that they now reckon that the dementia he is suffering from is as a result of his experience playing football, and in particular heading the ball. And how depressing, I'm not an England supporter, being a Welshman, but nonetheless, how depressing that it is true that so many of the players in the 1966 team have subsequently been found to have had dementia, depression, anxiety, almost certainly related to their playing of football. We put these people on a pedestal, and yet we're not prepared to protect them. And I'm still extremely critical of the way the Football Association has behaved around this. The problem this year in particular is that in the first lockdown, a lot of people with brain injuries were discharged early. I mean, I understand why it happened. Hospitals had to make beds available for people with COVID, but lots of units were closed. In the east of England and in the Midlands, which are the two areas that have done the most research into this, they found that 50 to 100% of all the beds normally allocated for neurorehabilitation were closed down, simply not available, and people discharged into community very swiftly. The Chartered Society of Physiotherapists has found that 80% of NHS services in this field have not yet been resumed. 80%. And of course, the number of people acquiring brain injuries during this time, through all the various different ways that I've already mentioned, hasn't slowed down. If anything, it's got faster. It's speeded up. And so we've always said in our all-party group that brain injury is, in a sense, a hidden epidemic, because the person who's standing in front of you in the queue and maybe slurring their words, you might think that's because they've been drinking, but actually it may be because they have a brain injury, but of course it's not written on their forehead, is it? And lots of the problems associated with the brain injury aren't visible, and so it's all the more important that we really dig down into the issues that there are here. The waiting list for community neurorehabilitation is now 4 to 6 months. That's a phenomenal length of time for families to be caring, sometimes in relation to, in the situation of COVID, when they're not even able to visit the person concerned. So there are major comorbidity questions as well. Patients have been discharged into adult social care with no rehabilitation at all. No neurorehabilitation at all. And of course, we now know that COVID itself is providing neurocognitive problems to lots of people. Not just those, incidentally, with long COVID, but other symptoms as well. And I guess that as COVID develops and as we get more understanding of the disease, and incidentally, as we are able to treat more people and, again, keep them alive, it's likely that we will have more people, rather than fewer people, who need neurorehabilitation. Of course.
I thank the Honourable Member for giving way again. And will he agree with me that actually we need now to make sure that those rehabilitation services come to the top of the pile, because it's causing a real problem for too many people in their everyday lives?
Absolutely. And I think one of the difficulties in this particular field is that although UK Acquired Brain Injury Forum, with which we've worked, and Chloe Hayward is wonderful, and although Headway is a wonderful organisation, though it's obviously having, like many charities working in this field, a really difficult time this year, the truth is, because there are many different routes to a brain injury, sometimes it doesn't acquire the same currency as cancer or other medical conditions, and yet it's at least 1.4 million people in the United Kingdom, if not more, who are affected at the moment. And that's one of the things we need to tackle. Specialist early supported discharge and community neurorehabilitation teams were actually redeployed in large numbers earlier on this year during the first lockdown, and many were furloughed. And in some cases, they've still not been brought back. And in lots of parts of the country, there simply are no services available in this situation. So what you have is the acute condition is ended up, the person with the acute set of problems isn't treated, but is then sent out, because the hospital bed is needed in the second lockdown, is sent out directly into adult social care with a phenomenally expensive care package. I'm not against the expensive care package, that's what you've got to do. But the point is that neurorehabilitation will be far more cost-effective, far better outcomes for the individual patient, and far more sensible for government if we could get that to sort out. And incidentally, the second lockdown, who knows whether we're having a third lockdown or tier situation or whatever it is, the truth is that lots of neuro patients are being discharged early. It's just a fact. And I think that that's going to give us a long problem, not only for the individual families and for the individuals, but it's going to give us a long problem in lots of local authorities and lots of community services. Now, what am I talking about? What's the real issue here? And I'll end in a moment, Ms. Eagle. Brain injuries, as I've said, come in many forms. Young brains are often particularly affected. Kids under the age of 5 from poorer families are 4 times more likely to have a brain injury, a significant brain injury, as are teenage kids from poorer backgrounds than those from wealthier backgrounds. There's a knock-on implication for the Ministry of Justice and so on. Sometimes it's the executive function that is affected. So people may find it difficult to inhibit some of their immediate instincts. Sometimes it's memory that doesn't work, or language, or elements of personality. For some people, it's a phenomenal fatigue, not just the kind of thing where, you know, you had a big night out the night before and you can't really be bothered to come into a Westminster Hall debate. It's a real fatigue that brings you to a point of absolute despair and an inability to feel like living. And then for many children in particular, sometimes maybe 9 or 12 months after the event, neurocognitive stall, where basically the brain seems to sort of go into like a I refused to go on strike and refused to work as anybody who wanted to. And the thing is that neurorehabilitation works. I don't mean just any old rehabilitation, I mean neurorehabilitation, where you use specialist staff who deal with these issues all the time, know about how the brain and the mind work together and how you can rehabilitate people. They work, it works rather, where it is there from the beginning, available consistently, for a period of time, for a sustained period of time, and where the connections between acute and community services are absolutely clear. And when it works at its best, it is such a joy, because you can see kids who were completely dependent on their parents and a whole team of social services people suddenly be able to smile again and be able to discover their own freedom and their own ability to get on with their lives independent of others. You see older people who are able to regain many of the physical and mental skills that they had before, regain some of their personality, and it's just such a beautiful and rewarding thing to behold. And that's why I just hope that the Minister will be able to give me everything that I want.
Thank you. The question is that this House has considered acquired brain injury and COVID-19. Minister Whately.
Thank you, Ms Eagle. It's also a pleasure to serve under your chairmanship. And can I congratulate and thank the Right Honourable Member for Rhondda for securing this debate on this really important matter. And I mean, actually, sort of so much credit and pay tribute to both his passion and his huge knowledge on this subject. And I know he's debated it with other ministers at length, and which he brings to the knowledge he brings to this debate and other debates he's had on this, and also his commitment to this and the tireless work that he takes. And of course, I know that he speaks from direct personal experience on this as well. So I'm a huge, indeed, pay tribute to him for all that he brings to this, and also very good to have the Honourable Member for Blaydon here as well, and thank her for the work that she's doing with the APPG, and the Honourable Member for Rhondda on campaigning for those who acquired brain injury. I'd also like to take this opportunity to recognise the vital work of charitable organisations such as Headway, the UK Acquired Brain Injury Forum and the Disabilities Trust. Their work is also invaluable, not only in raising awareness, but also providing hands-on help and support to patients, families and carers. And I will say I am very aware that acquired brain injury, or ABI, not only affects an individual's health, but affects their family, their work, their relationships, their education. For instance, in the case of children, has such huge impact on people's lives. And I will say, as the Honourable Member raised, I have indeed met people who've had a brain injury. Shortly after I was elected, I went and visited Kenton Canterbury Hospital, which has a neurorehabilitation unit, and spoke there both to staff and patients, and saw the really impressive work that they were doing there. So I absolutely appreciate the points he makes about the importance of effective neurorehabilitation. Clearly, the pandemic has, as he has set out, had a real impact on the care and treatment of people with acquired brain injuries. And as he said, staff have been redeployed onto frontline COVID work, and that has affected people's care. And, for instance, some consultations I know have been moved online, and services are not what you'd want them to be. I will say that face-to-face neurology rehabilitation services are being restarted as quickly as possible. Guidance has gone out from NHS England, Improvement, and the Association of British Neurologists, and every effort is being made to catch up on the delayed care. But I will look into the points he makes about his concern that services are not yet up and running. I do want to recognise that the pandemic will have been a really difficult time for those affected by ABI across a range of areas, not simply access to healthcare services. So the debate today and previous debates do owe a debt of work to the All-Party Parliamentary Group and the Right Honourable Member's leadership and I'll flag the wide-ranging inquiry into the causes, impact and treatment of ABI, culminating in the report that was published in October 2018, which set out a host of things that we need to address across government. And as he will know, my department worked with officials across Whitehall to give a response back in February 2019, and I welcome the fact that the APPG, together with UKABIF, continues to drive the Time for Change agenda, most recently in an online summit that was held on the 16th of November. One of the key issues highlighted in the report, and as the Honourable Member has said again today, is the importance of better government coordination. I absolutely take his point. I think he referenced a conversation with the Chancellor of the Duchy of Lancaster. I will speak directly for health, but I am very aware that brain injury cuts across almost all aspects of an individual's life, from education to work and welfare, and sadly, sometimes the justice system. So we do indeed need to work on this across government, and I will be driving stronger coordination for ABI across government and be working with my officials to do that. Just turning to the services available to patients with ABI, as he will know, we've had since 2012 22 regional trauma networks across England, and within these major trauma centres can provide specialist care that patients need with major trauma, including brain injury. And alongside that, timely and appropriate neurorehabilitation is a critical part of care, which, as he set out, is absolutely crucial for improving the outcomes for people with brain injury. And for patients with the most complex need, NHS England commissions specialised rehabilitation services nationally, and trauma unit teams then work to assess and develop a rehabilitation prescription, or RP, for brain-injured patients. RPs are rightly regarded as very important for rehabilitation, as they reflect assessment of the needs of the patient in the round. And that approach is showing results. As he knows, the latest data shows that 94% of patients accessing specialist rehabilitation have evidence of functional improvement. Coming to local commissioning, as he spoke about, and talked about, I guess, the differences that you will see across the country. I mean, it is the case that the majority of rehabilitation is commissioned locally. And to support that, NHS England has produced guidance setting out what good rehabilitation looks like and what services people should expect. Community services clearly play a crucial role, and the NHS... I will indeed take his motion.
I'm grateful for the nice comments that the Minister's made, but one of the problems with this guidance is that it doesn't feel very enforceable, and until the money goes with the guidance, as it were, I think it's unlikely that people will invest in this. It does feel sometimes, not to use a cliche, but a bit too Cinderella-like, and I just wonder whether there's a means of twisting this into enforceability.
Yeah, I absolutely take his point, and I mean, I've heard the argument made for this, but also other services which are commissioned locally. And you've got the holy grail of wanting both a locally responsive health service, which people want a locally responsive health service to respond to what the local community needs, but on the other hand want consistency. And achieving both of those is hard and arguably not entirely possible, because the mere fact of having something that's locally responsible will involve some variation. But I think I also take away this point is that there are ways that you can try and achieve a higher overall standard and some more consistency without necessarily going all the way and saying, well, it must be done exactly this way everywhere. And oversight is one way of doing that. So I'll take away his point and see whether there is further we can go there. And I just want to pick up on the list of questions or wish list as we approach Christmas. Demands in that case. And see which of those I can give answers on. So one of them was about a national neurorehabilitation lead. So what I can say that is that during COVID-19, for this period, there is indeed a national lead. So Susan Rastrick has been designated as the National Clinical Director for Rehabilitation, coordinating clinical advice and leadership in that area. So that is for the period of COVID, and I clearly take away his demand that it should be for beyond COVID rather than just for the pandemic. So I hear that. He asked about the reinstatement of all neurorehabilitation services after COVID and will they be restored. I have no reason to believe that that would not be the case, but I will again take away and make sure that we see that happening. And he asked about the specialties, the protection of neurorehabilitation. Is it one of the 12 specialties which are protected during COVID? To which I can broadly answer yes. So NHS England has made a specific provision for a subset of services to ensure they are protected and that complex rehabilitation services are included in this. So I hope that gives him the answer at least he seeks on that. I will also take away his ask on for a national neurorehabilitation strategy as something to look as to whether we can do. It's a very clear request to have made. So can I just... well, I was just going to conclude, and then I believe the Honourable has a couple of minutes at the end if I conclude.
No.
He doesn't have that. In that case, I will take his intervention.
I'm grateful. It's just about the central... I fully get, of course, that one of the dangers of having a postcode lottery is that if you try to overturn it, then you end up not having any freedom locally and all the rest of it. But I just say again, the Chancellor of the Duchy of Lancaster really needs to get everybody together, because I think that there are real benefits that we could deliver to people and financial savings across the whole piece as well.
I think the Right Honourable Member makes a really good point on that, and I'd say I will take it away, as he knows. I think the Chancellor of the Duchy of Lancaster has done so as well. And I would say, in conclusion, that do take this absolutely seriously. Clearly, COVID going on has been put huge pressure on the department, on ministers, on the whole health service. But he raises a really important point about how seriously we must take the care, treatment and rehabilitation of those with acquired brain injuries. And can I finally thank him again for all he's doing to campaign for this and for the impact he has in doing so.
The question is that this House has considered acquired brain injury and COVID-19. As many as are of that opinion say aye. Aye. The contrary, no. I think the ayes have it. The ayes have it. Order, order. Where's the other one?